Good day, everyone. I'm very happy and very pleased and honored that I am one of those chosen individuals to present something that could be shared to all of you. And thank you for taking time to watch my presentation entitled Healthcare Information Management System, or HIMSS, the USTP's experiences on online teleconsultation, ensuring delivery of health services in the new normal. As background rational, it's very important that we ensure the delivery of health services to students in this new normal because it plays a vital or significant role at this time of pandemic. So if you observe, we are all affected with the pandemics. It's not only the students, but also the faculty and staff in our respective institutions. And with that challenge of the World Health Organization that we need to reorganize and safely maintain access to high quality essential health services in the pandemic context, because if you observe during the time of pandemic, there was really limited mobility and resources. But the question is, there's already hospital scare. People don't want to go to the hospitals anymore. But in what way we could reach out to them to ensure that they remain healthy, that mentally they're good, because these are the moments where we are challenged on how we could cope with the situation. So with that in mind, the university created this platform through an institutional project, which is HIMSS, or the Healthcare Information Management System. And this is a teleconsultation platform to ensure that our students, our faculty and staff have access to licensed nurses and medical doctors at the comforts of their homes. So in this way, they could really communicate with them via online. So let's take a quick tour. What is this HIMSS all about? So the moment you go to your healthcare or HIMSS, you can, this is hims.ustp.edu.ph. You can log in as a patient, and then you of course, you type your username. Okay, so allow me to type my username and then my password. There you go. So the moment you log in, if you observe, you already have, so this is an example of my profile for the healthcare services. So these are my appointments. You can see my appointments here. And I'm very happy to the pandemic, even my family members, I could communicate with them. And this is my personal health record, and I could have access for mental health issues. I could refer to the guidance office, or even my students, I could refer it to them and they can chat with them. These are my appointments, then consultation timeline, vaccination. I need to update regarding my vaccination so that university will know who are vaccinated or not. Of course, during the time of pandemic, I got COVID as well. So my temperature is always monitored. So there's what we call temperature logs, and the COVID-19. So example, these were my temperatures when during the period just this year, last February. So see, in this case, I am monitored by the nurses. They could also call me. They could check me in my isolation unit. So this is the good thing about the healthcare information system. And here also you can have your prescriptions. What are the prescriptions that could be given to you, the medicines that you could buy. So this is really helpful because there is video conference. If it's not possible for video conference because you don't have enough resources, then they could call us via phone. So these are the good things that we could really see in the whole platform. So let me go back to my presentation. So that's the HIMSS all about. So it's very friendly and it's easy to use. So through HIMSS, COVID-19 cases and health-related concerns were addressed and monitored in their respective homes and isolation units. So thus, USTP's experiences feedback was important to continually improve its services as part of its student support, and of course to the faculty and staff as well as part of the development program of the university. And HIMSS could also be reached through the healthcare information system via Facebook. So this is the Facebook page that you have. You can send message to them. You could also update you could also be updated of the latest services from the health services, so that aside from the HIMSS, what other services that could be offered. So everything is updated also here in the social media. So this is an example of in what way we were informed, in what way we were trained. So our faculty and staff, because there are, during the time of pandemic, there are, just like me as designated faculty, I need to report to the office. So we were also trained how to use it. And for our students, they were communicated, contacted via Zoom. So there was like um, an orientation followed by a workshop, so that they could easily navigate the platform. So this is an example of, as of April 30, 2022, the total number of clients that we have served already reached to 6,757. So this is like the summary in both physical and virtual setup, the number of students and faculty and staff who availed, and in terms of gender, so majority, 57% availed of our services, and number of clients served per campus, because we have 8 campuses. And if you observe, we have USTP CDO, or Cagayan de Oro, has the most number of clients, because this has the largest number of population. And of course, the total services utilized, whether guidance, psychological, dental, or medical health services. If you observe, majority are geared towards medical health services. All right, so this is the data census. So this is an example feedback that we gathered from our clients. So this platform was created by Engineer Morial and his team, and he is actually our Vice Chancellor right now of the Research and Innovation, and we're so grateful to him making this platform so that our students can be served, our faculty and staff as well. So on a scale of 0 to 10, we observe that majority of them would rate that they have good, excellent services. So there's still 9. So there's still a space for us to improve in this platform. But if you look at the way their satisfaction in terms of seeing their doctor virtually, they're very satisfied. So this is something good. In terms of their experience in consulting the doctor, so earlier was like, the difference this time is the process of booking, but this time is their experience. They're also very satisfied with their consultancy with the doctor, excuse me. And then in terms of their medical staff, because the process is before they will have the doctor, they will be assessed first by the medical staff or nurse. Then after that, if the nurse could not resolve the issue from their level, that's where they refer it to the licensed medical doctor. So if you observe, majority also were very satisfied. So this feedback is taken regularly, and this is the latest one that we got from our system. So please rate your experience in using the system. So majority of the respondents in this at this time when this was collected, they're very satisfied. Some were satisfied, but there's a small percentage of unsatisfied. So this is where that, because this is just 2 years old, so this is a very good feedback, because in this way we could get some ways to continually improve as a service unit. So your primary healthcare provider conducted a diagnosis. So if you see, the majority of them also, they are very satisfied. And in prescribing medications, they're also very satisfied, with some satisfied. And in terms of appointment, there are majority of them are saying that they're being entertained within 30 minutes, but there are also cases that it took them an hour or 30 minutes to 60 minutes. So this is the area that we need to improve. And the feedback, probably the feedback rather was because of some internet connectivity, some issues. So it got delayed because of the connection. So would you consider healthcare information system or HIMSS for your future medical services? We're very happy that all of them really considered that this is a helpful platform, because they would consider using HIMSS in the future for their medical needs. So findings also revealed that they found the platform helpful because e-prescription could be provided. That's why majority were saying that they were happy, they're satisfied. And Those who experienced COVID-19 felt they were safe and secure with the guidance of health practitioners. These are the licensed nurses and doctors in order to survive the pandemic due to hospital's care. So we're very glad and we're very happy that we are able to reach out to our students, faculty, and staff. So one notable feedback from the end users was the kind and emotional support of the health practitioners by calling them via mobile phones as part of the monitoring stage. So daily, they actually being called by their health practitioners or their medical staff or nurse assigned to them. So for now, we have around more than 10 nurses and 5 to 6 medical doctors attending throughout the system. So this is to ensure that in each campus there is really a designated nurse or or physician to attend to their needs. So in conclusion, this online platform, which started as an institutional funded project, is now sustained by the university as part of USDP services adapting to the new normal. So we're very happy that the university found this very useful from an institutional project, and we hope that we could sustain this not only during the pandemic to ensure that whatever happens, we could reach out to our clients and giving them a better service and ensure to keep them healthy. So this is where I end my presentation. Thank you so much for giving me the time to share, and I would love to listen to you as well if there's a chance. And thank you so much for being with me in this presentation, and I hope that you find this very helpful. Have a great day, everyone.